Intra-aortic balloon pump IABP is most often used in the management of A. Congestive heart failure, B. Cardiogenic shock, C. Pulmonary edema, D. Aortic insufficiency. And the answer is B. Cardiogenic shock. Intra-aortic balloon pump IABP is most often used in the management of cardiogenic shock. Cardiogenic shock occurs if the heart suddenly cannot pump enough oxygen-rich blood to the body. The most common cause of cardiogenic shock is damage to the heart muscle from a severe heart attack. This damage prevents the heart's main pumping chamber, the left ventricle, from working well. The intra-aortic balloon pump IABP is a mechanical device that increases myocardial oxygen perfusion and indirectly increases cardiac output through afterload reduction. It consists of a cylindrical polythene balloon that sits in the aorta, approximately 2 cm from the left subclavian artery. It helps your heart pump more blood. What is the special area in the right atrium containing special nerves in which the regulation of systole can be maintained? A. Sinoatrial node, B. Atrioventricular node, C. Atrioventricular bundle, D. Purkinje fibers. And the answer is A. Sinoatrial node. Sinoatrial node is the special area in the right atrium containing special nerves in which the regulation of systole can be maintained. The sinoatrial node, also called SA node, is literally the pacemaker of the heart. It regulates heart rate through specialized conduction and first communicates to the atria, causing them to contract, and then communicates to the atrioventricular node, which in turn communicates to the ventricles, causing them to contract. Which emergency drug is used for the immediate management of SVT, supraventricular tachycardia? A. Injection atropine, B. Injection nicorandil, C. Injection adenosine, D. Injection heparin. And the answer is C. Injection adenosine. The emergency drug which is used for the immediate management of SVT is injection adenosine. Injection adenosine slows conduction time through the AV node, can interrupt the re-entry pathways through the AV node, and can restore normal sinus rhythm in patients with paroxysmal supraventricular tachycardia (PSVT), including PSVT associated with Wolff-Parkinson-White syndrome. What is dextrocardia? A. Heart situated in the right side, B. Heart situated below diaphragm, C. Heart situated above the sternum, D. Heart rate is abnormal. And the answer is A. Heart situated in the right side. Normally the heart points towards the left side of the chest. But in a rare condition the heart points towards the right side, and this rare condition is called as dextrocardia. Which of the following is not a risk factor of atherosclerosis? A. Obesity, B. Smoking, C. Stress, D. Diet low in fat. And the answer is D. Diet low in fat. Diet low in fat is not a risk factor of atherosclerosis. Atherosclerosis is a disease of the arteries characterized by the deposition of fatty material on their inner walls. Hence, having a diet low in fat only decreases the risk of atherosclerosis. Which of the following is the complication of myocardial infarction? A. Heart failure, B. Arrhythmias, C. Cardiogenic shock, D. All of the above. And the answer is D. All of the above. Heart failure, arrhythmias, and cardiogenic shock are all the complications of myocardial infarction. After birth, which anatomical hole closes as to allow proper functioning of the lungs? A. Foramen oval. B. Oblique oval. C. Atrial oval. D. Circumflex oval. And the answer is A. Foramen oval. Foramen oval is the anatomical hole which allows the proper functioning of the lungs after it closes. The foramen oval is an important structure in the fetal heart, allowing blood to flow directly into the left atrium from the right atrium. Blood is directly bypassed due to the fact the lungs of the fetus do not breathe while in the womb, and the blood is oxygenated by the maternal lungs. Therefore, it is not necessary for the blood of the fetus to divert to its own lungs via the right atrium. Instead, it goes directly to the left atrium. Which one of the following is not a serous membrane? A. Pleura. B. Peritoneum. C. Mucosa. D. Pericardium. And the correct answer is C. Mucosa. A mucous membrane or mucosa is a membrane that lines various cavities in the body and covers the surface of internal organs. Mucosa consists of one or more layers of epithelial cells overlaying a layer of loose connective tissue. Some mucous membranes secrete mucus, a thick protective fluid. What is the study of how body parts function called? A. Histology. B. Physiology. C. Homeostasis. D. Metabolism. And the correct answer is B. Physiology. Physiology is the study of how the human body works. It describes the chemistry and physics behind basic body functions, from how molecules behave in cells to how systems of organs work together. One of the functions of bones is to make red blood cells. What is this process known as? A. Hemolysis. B. Hemopoiesis. C. Hematuria. D. Hemostasis. And the correct answer is B. Hemopoiesis. Hemopoiesis is also known as hematopoiesis. It is a process through which the body manufactures blood cells. It begins early in the development of an embryo, well before birth, and continues for the life of an individual. Which of the following muscles is named after its origin and insertion points? A. Tibialis anterior. B. Extensor digitorum longus. C. Rectus femoris. D. Sternocleidomastoid. And the correct answer is D. Sternocleidomastoid. The sternocleidomastoid has its origin on the sternum and clavicle, while its insertion is on the mastoid process. It is one of the largest and most superficial cervical muscles. It is a thick muscle on each side of the neck, the action of which assists in bending the head and neck forward and sideways. Which hormone is responsible for the contraction of the gallbladder? A. Secretin. B. Gastrin. C. Cholecystokinin. D. Intrinsic factor. And the correct answer is C. Cholecystokinin. Cholecystokinin is released from mucosal endocrine cells in the proximal small intestine in response to a meal. It is classically known to stimulate the gallbladder contraction. Which of the following structures together make up the brainstem? A. Medulla oblongata, pons, midbrain, cerebellum. B. Medulla oblongata, pons, midbrain. C. Medulla oblongata, pons, midbrain, thalamus. D. Medulla oblongata, pons, midbrain, pineal gland. And the correct answer is B. Medulla oblongata, pons, midbrain. Medulla oblongata, pons, and midbrain are the structures which together make up the brainstem. Which part of the ear contains the apparatus that we use to distinguish between different frequencies of sound? A. The cochlea. B. The eustachian tube. C. The tensor tympani. D. The auditory meatus. And the correct answer is A. The cochlea. The cochlea analyzes sound frequencies by means of the basilar membrane, which exhibits different degrees of stiffness or resonance along its length. What is the fibrous protein in our skin that protects it from abrasion? A. Melanin. B. Keratin. C. Sebum. D. Elastin. And the correct answer is B. Keratin. The outermost layers of the skin is composed of dead cells filled with keratin. Keratin that helps waterproof the skin and that protects the skin and underlying tissues from heat, microbes, abrasion, and chemicals. Which one of the following is a bone that is embedded within a tendon? A. Sphenoid bone. B. Hyoid bone. C. Ethmoid bone. D. Sesamoid bone. And the correct answer is D. Sesamoid bone. In anatomy, a sesamoid bone is a bone embedded within a tendon or a muscle. Its name is derived from the Arabic word sesamum, that is sesame seed, indicating the small size of most sesamoids. Which type of epithelium is found lining blood vessels? A. Simple squamous epithelium. B. Stratified squamous epithelium. C. Simple cuboidal epithelium. D. Stratified cuboidal epithelium. And the correct answer is A. Simple squamous epithelium. Simple squamous epithelium lines the blood vessels. In a cell cycle, which phase takes the longest time to complete? A. Anaphase. B. Interphase. C. Prophase. D. Telophase. And the correct answer is B. Interphase. Interphase is the longest part of the cell cycle. This is when the cell grows and copies its DNA before moving into mitosis. What is the name for an immovable joint? A. Amphiarthrosis. B. Diarthrosis. C. Synarthrosis. D. Monoarthrosis. And the correct answer is C. Synarthrosis. Synarthroses are immovable joints. This is a type of joint which allows no movement under normal conditions. Sutures and gomphoses are both synarthroses. The sutures in the skull are examples of immovable joints. Which one of the following is a function of the liver? A. Lipase. B. Digestive enzymes. C. Insulin. D. Plasma proteins. And the correct answer is D. Plasma proteins. Plasma proteins, that is albumin, globulin and fibrinogen, are produced in the liver. Where are the semimembranous and semitendinous muscles located? A. Seminal vesicle. B. Thigh. C. Forearm. D. Back. And the correct answer is B. Thigh. Collectively, semimembranous, semitendinous and biceps femoris are referred to as the hamstring muscles. Semimembranous along with the semitendinous occupies the medial aspect of the posterior thigh. It is a relatively long muscle that spans the full length of the thigh, from the hip to the knee. The uppermost and largest bone of the pelvis is A. Iliac crest. B. Ilium. C. Ischium. D. Obturator foramen. And the correct answer is B. Ilium. The ilium is the largest part of the hip bone and makes up the superior part of the acetabulum. Which bone in the human is called the tailbone? A. Lumbar vertebrae. B. Sacrum. C. Patella. D. Coccyx. And the correct answer is D. Coccyx. The coccyx bone in the human is called the tailbone. Which bone in the forearm region is on the pinky finger side? A. Radius. B. Ulna. C. Tibia. D. Fibula. And the correct answer is B. Ulna. In the forearm region, ulna bone is on the pinky finger side. Which bone in the forearm region is on the thumb side? A. Radius. B. Ulna. C. Tibia. D. Fibula. And the correct answer is A. Radius. In the forearm region, radius bone is on the thumb side. Which bone in the human is called the beauty bone? A. Sternum. B. Clavicle. C. Maxilla. D. Fibula. And the correct answer is B. Clavicle. The beauty bone is mostly just another name for your collarbone or clavicle, especially in women. It is the bone located above the ribs in the chest. The word foramen means A. Opening or hole in a bone. B. A joint or socket of a bone. C. An area found only on the male pelvis. D. None of the above. And the correct answer is A. Opening or hole in a bone. An opening, hole or passage, especially in a bone, is called a foramen. The shoulder blade bone is called A. Vertebrae. B. Incus. C. Scapula. D. Fibula. And the correct answer is C. Scapula. Shoulder blade is also called scapula, shoulder bone, shoulder blade, wing bone, spial bone or blade bone. Scapula is the bone that connects the humerus with the clavicle. The bones of the vertebral column are classified as which type of bone? A. Flat. B. Irregular. C. Long. D. Short. And the correct answer is B. Irregular. Irregular bones vary in shape and structure and therefore do not fit into any other category like flat bones, short bones, long bones or sesamoid bones. Irregular bones often have a fairly complex shape which helps protect internal organs. For example, the vertebrae, which are the irregular bones of the vertebral column, protects the spinal cord. How many facial bones do you have? A. 23, B. 14, C. 17, D. 42. And the correct answer is B. 14. The facial bones include 14 bones with 6 paired bones and 2 unpaired bones. The paired bones are the maxilla, palatine, zygomatic, nasal, lacrimal and inferior nasal concave bones. The unpaired bones are the vomer and mandible bones. Raising the arms to the side of the body while performing dumbbell lateral raises is an example of what motion? A. Circumduction. B. Flexion. C. Abduction. D. Adduction. And the correct answer is C. Abduction. Raising your arms at the side of the body is an example of abduction, whereas lowering them down is an example of adduction. What is the name of your kneecap bone? A. Patella. B. Clavicle. C. Tibia. D. Neexoid. And the correct answer is A. Patella. The patella, also known as the kneecap, is a flat, rounded, triangular bone which articulates with the femur and covers and protects the anterior articular surface of the knee joint. The top portion of the sternum is called A. Xiphoid process. B. Manubrium. C. Scapula. D. Incus. And the correct answer is B. Manubrium. The top portion of the sternum is called manubrium. Which long bone makes up the upper part of the arm? A. Clavicle. B. Humerus. C. Radius. D. Femur. And the correct answer is B. Humerus. Humerus is the long bone which makes up the upper part of the arm. Gliding movement occurs at what type of joint? A. Pivot joint. B. Ball and socket joint. C. Saddle joint. D. Plane joint. And the correct answer is D. Plane joint. A plane joint is also called arthrodial joint or gliding joint or plane articulation. A plane joint is a synovial joint which under physiological conditions allows only gliding movement. Olfactory nerve is related to A. Sight. B. Sense of smell. C. Peristalsis. D. Facial sensation. And the correct answer is B. Sense of smell. The olfactory nerve is the first cranial nerve that contains sensory nerve fibers relating to the sense of smell. How many heads does the biceps brachii typically have? A. 4. B. 2. C. 3. D. 1. And the correct answer is B. 2. The biceps muscle has two heads, the short head and the long head, distinguished according to their origin at the coracoid process and supraglenoid tubercle of the scapula respectively. Which is the smallest muscle in the human body? A. Gluteus maximus. B. Stapedius. C. Deltoid muscle. D. Quadriceps. And the correct answer is B. Stapedius. The stapedius muscle is the tiny muscle in the middle ear that attaches to the posterior aspect of the neck of the stapes.